Hello, everybody. Thank you so much for joining us. Good afternoon or good morning if you're joining us from the West Coast. My name is Isabel Lopez. I'm Rural America's digital organizer and host for this episode of Refugee Matters, where we'll be talking about mental health and healing in times of crisis. If this is your first time tuning into one of these episodes, I'd love to give you a little bit of background about Refugee Matters. Refugee Matters is a podcast series produced by We're All America, where we dive deep into the policies, issues, and advocacy efforts that shape the lives of people impacted by displacement. This really is a space where we want to bring important conversations to the forefront and make sure that we're elevating the voices and perspectives of people with lived experience. We had many people be interested in this episode. In fact, Diana, I don't know if I mentioned this to you, but this was our highest registration for people attending the live episode. So it's a very needed discussion in our community right now. And I'm so happy that you'll be joining us today. I'd love to share some information about Diana before I pass it on to you to introduce yourself a bit more. Diana is a bilingual, bicultural, and Latina immigrant, as well as a therapist and consultant offering telehealth services to California communities through her practice, Corazón, Norte. Diana draws from her own life experiences and specializes in assisting BIPOC individuals, especially those from Latino, migrant, and mestizo backgrounds, seeking to work on intergenerational wounds and promote generational healing. Her clinical expertise includes individual psychotherapy and immigration psychological evaluations. So I'll turn it off to you, Diana, to introduce yourself a little bit further.
Yeah, hi everybody. Thank you for being here, and thank you, Isabel, for the invite. Like Isabel mentioned, my name is Diana. I am a therapist, a public health practitioner, and most importantly, I am an immigrant from Ecuador. I arrived to this country at 16 years old, so this type of work is really very close to my heart. I have spent about the last 17 years or so in immigrant mental health at different capacities. Until recently, we found Corazón Norte, and I just wanted to tell you a little bit about us. So starting with our name, Corazón Norte came from, heart means corazón and norte, north, because all of us bring our heart to the north, all immigrants, and not just our labor, but our hearts, our dreams, our hopes. And this organization was funded to serve immigrants and also the providers that are serving immigrants, because we often get put to the side. So we are very, very intentional about creating spaces for us and by us.
So as folks watch, this is a live podcast. So even though it's going to be Diana and I having a conversation, we'd love to read your comments and your questions if you have any. We will have some time towards the end to get to any audience comments. So feel free to tune in the chat and be a part of the conversation with us. So Diana, to get us started and really centered in this conversation that we're going to have about mental health, I think it's really important to acknowledge that in this country, in this society, this very individualistic society, talking about mental health and self-care has become very commercialized. And it feels like something that everyone is constantly saying that we have to do. And then when you're not taking care of yourself, you feel bad about it. And it's suddenly like, it feels like the world is burning outside and people are just telling you like, well, but have you done face masks today? And it's like, this isn't going to fix this. And mental health, battling with mental health manifests itself in a lot of different ways and can affect more than just our disposition and our mood, but can have very strong implications in the rest of our body and our life. So I'd like to begin with having a good understanding of what trauma is, how trauma manifests itself in the body, what are the different trauma responses, and specifically how is trauma experienced by our immigrant and refugee communities?
Yeah, absolutely. And you're so right. Sometimes, I don't know about you, but I consistently hear self care and burnout, but we don't really take into consideration that some of those stuff really think it's a very individual thing, and we don't take into context everything else that is happening around us that is actually affecting our mental health. But back to your question. So, yeah, some of the trauma responses that we experience, and this is not just immigrants, refugees, and asylum seekers, this is everybody. We all experience these in the face of trauma, which are the responses or fight, flight, freeze, or fawn. So, the first one is, we feel like we're so ready to just get down and continue this fight. Sometimes that may look like actually having fights with loved ones on certain topics. It may be just being really feeling stressed out to the point that you don't want to be in this situation. And what our brain does to try to protect us is has this response in which is almost like your mind tries to leave in a way. So that's like flight. You're trying to get out of that situation as soon as possible. You are avoiding certain locations that remind you of things that are painful, or people that remind you of situations that are painful. And then we have also the freeze, which I know I have found myself several times on that one lately, in which things are just so traumatic and so triggering that you freeze and you don't know what to do. And that's when we start feeling that pressure in our chest. I don't know where you feel it, but for me, I feel it right in my throat. I want to speak, and it feels like words are not coming out. So those are some of the reactions that we may be experiencing at different levels, of course. And the thing about us in those that experience chronic trauma exposure is that sometimes there hasn't been a period in life in which we haven't experienced a traumatic event. And for some of us, it even begins in utero. It begins even before we're in here. There has not been a consistent space in which there's not another violent event, there's not another war, there's not another issue. So it's really hard for our brain to know. When people say, well, go back to a place that is great. What if I don't have a place? What if it has been so consistently a terrifying space for us? So those are some of the responses that our body has, and it affects us in the long term so much, not just mentally, but physically, because these are psychosomatic responses as well. So if you notice, you may be having some more stomach issues, more headaches, more tensions throughout the body, even in your joints. We hold the stress in your joints as well. So sometimes your hands may feel tight. That's why as well. So those are just some of the things that you can keep an eye on that are more of like trauma responses.
So interesting about the stomach issues. I didn't know that it could manifest that way, and I feel like that probably explains a lot of what's been going on the past couple of, honestly, yeah, couple of weeks specifically. But the point that you bring about how trauma and dealing with the moment affects all of our body in different ways leads me to the next question, Diana. I'd love to hear other ways in which prolonged fear and stress impact our nervous system and our immune health.
Yeah, so that's a really interesting one, because now as science gets better, we keep learning more and more. And I don't know if you have heard about the book, The Body Keeps the Score. It's so true. It's a great book. And for you, if you haven't read it, it's fantastic. It helps you really put into context so many things that you may have been experiencing throughout life. And then you suddenly read it in a book and you're like, that makes a lot of sense. But yeah, so this constant fear and stress in our body, it really makes us stay in high alert, which always we're always ready to brace for danger, which in turn then activates our nervous system, and we are staying this high alert. So then, like, I don't know if it has happened that you have experienced so many things throughout life, and all of a sudden you just trip in the street with a rock. And man, you feel like the whole day is over. And you're like, but how? I have experienced so many things. And then this tiny little inconvenience, this obstacle just made me lose it. That's why. It's because we are in such a high levels of stress consistently that at that point, just any little thing really can put us over the edge. And what happens is with our nervous system, it floods us with these stress hormones like cortisol, and over time it wears us down. So people may be feeling constantly anxious, they're having trouble sleeping, it may be hard to manage your emotions. But it's also just not about only about our feelings. Our immune system also gets really impacted, making us way more likely to get sick. And it's just simple things as colds. I I don't know how many times I work, and I have worked with a lot of like human rights activists and lawyers, immigration lawyers, and social workers, and somebody's always has a cold, and it's consistently we like go rotating. It's because our immune system start to get a little bit more impacted as well, and then. Outside of the immune system and outside of mental health also, I think this stress puts us in a situation in which we're often like we don't know how to make decisions anymore because we don't know what's coming next. So even planning things like I'm going to buy a car, well, maybe I should not know, maybe I don't need to buy a car right now because I don't know if I'm going to be deported to my country, if I don't know if I'm going to have a job next week because everything is changing. So it impacts even to the level of the decisions that we make on a day-to-day basis.
Just doing a quick check, making sure that you can hear me okay, Diana.
Hear you now. Can you hear me?
Yes, all good. I love the point that you make about how for some people, the trauma starts in utero and there might not have been a day of happiness in their life that they can recall. And I think that in our communities, this is a story that repeats for a lot of people. When they were young, they had to leave their homes because of wars, because of famine, because of persecution. They have to come to the US. In some cases, they have to live undocumented, and all of the stress and fear that entails. But even beyond our communities, when we think about Black people in the United States and the over policing, the racial prejudice, and how that translates to unequal health outcomes, I think these are really important things for us to talk about. So, my next question is how do systemic injustices and ongoing crises keep people in a state of fear, and how can we break that cycle?
Yeah, and thanks for bringing that intersectionality into this conversation, Isabel, because the reality is that an injustice to one is an injustice to all. It doesn't matter if it's African American community versus immigrant communities. We are all kind of being affected by the same things, and we have different intersectionalities that cross. So I may be an immigrant, but I may also be part of the LGBTQ community and also part of the African community. So there's just different things that are impacting us. And there's something that's called, and most people probably have heard, is social determinants of health. So what that means is essentially where you live, where you work, where you play, where you just do your everyday activities. It's impacted by literally, it's like where your zip code is. So where are you located? It may have less or more access to different resources like high quality education, access to medical care, transportation. So when we look at these, comparing two neighborhoods. So a neighborhood that may be more affluent, that may have more parks for people to be walking, to be able to be active, has great school systems versus areas that are more financially impoverished. And people don't have access to those things. So it actually impacts their health long-term because they don't have access to things that they should have access to. And one of the things that often it doesn't get added into as a social determinant of health, it's immigration. And it should absolutely be considered a social determinant of health, because the fact that we don't, some people may not have status means that they cannot access certain healthcare systems. It means that also you may be living in neighborhoods that are more low income, so less clinics, less doctors to a higher ratio of patients. Schools are more crowded for the kids. They may not have the resources that they need to incorporate for children that have just arrived and are adapting to a new culture, to a new language. And also the financial instability. For example, for our asylum seeking community, they may be waiting a whole year or more to receive their employment authorization card. And in the meantime, how do they support themselves? So their immigration is actually impacting their ability to provide for them financially, which impacts their ability to have access to resources for health and mental health and to be stable. So definitely there's so many systemic things that are happening, and breaking the cycle isn't just about good intentions. It takes actions, and that includes funders investing in those people with lived experiences, the people who have walked these paths, because we know better, we understand the challenges better than anyone else in our communities, and are the best equipped to provide minimal solutions. It also, it really helps to be able to be an advocate for policies, for clinics, to be in school boards, to help ensure that our immigrant community has access to different resources, and to be able to be heard. It's not just about passing the mic, but it's about actually opening doors for people to be able to make meaningful change.
I love that, Diana. Thank you so much for bringing in the full context of both the systemic aspect, and recognizing that fixing a systemic problem like this requires actions taken from different points and from people that come from all walks and shapes of life, and that they should be led by those most impacted. I know that up until now, a lot of what we've talked about is kind of like the complexity of the mental health crisis facing our communities and the advocates in the space right now. And we also don't want it to just feel like a lot of disillusionment that, this is just the moment we're living through, and we're not equipped, our bodies are, we're just not equipped to handle all this fear and distress, because that's how we will end up burning out, and we need to stay in this for the long run. So can you tell us some practical ways that people can cultivate inner peace while facing all this external instability?
Yeah, definitely. And we also talked about, self-care and burnout feeling like it has been trivialized a little bit. And I think, besides, there is absolutely a moment to use stress balls, to do grounding, to do mindfulness. But I think one tool that we don't talk about often is the tool, the space or the strategy to be able to even start mapping our pain. And that is something we take for granted, because I don't know about you, Isabel, but for me, when I cannot pinpoint why am I feeling a certain way and it feels just so overwhelming, it becomes so much worse, the pain and the anxiety and the exhaustion about it. So a tool that is really great is to be able to put a contents, put a framework to what we are feeling. So mapping the pain in different ways. So we talked a little bit about trauma responses, right? So if I'm able to kind of map in what is happening right now within changes in policy, programs being closed, different things happening, if we can say, hey, I have this understanding of trauma responses. I understand that right now I may be in flight mode. What are some things that I can use when I'm feeling like I'm running out of a place? And that may be like slow down your breathing. It may look like finding some comfort, which it may be completely different if you are on fight mode, right? But if you are able to understand, here I am in fight mode, what are some other things that may be different that I need to use at this time? So if I'm in fight mode, maybe my fists feel like I'm ready to really like almost fight. Let's get something to kind of just put in your hands that you're able to release some of that tension in. So that's one way of using frameworks, but also another way of using frameworks is another one. And we created a toolkit for human rights defenders on self-preservation. And we have divided them also very intentionally in the language that we use of framing as what we're experiencing right now in the terms of stages of grief. Because the stages of grief, sometimes we may be angry at the situation. We may be in this belief of why is this happening? Is this actually real? And I know for a fact a lot of us have been in the last 2 or 3 months. Can this even happen? Is this even legal? Is this even possible to be happening? So we can frame it on that, and we can frame it like we can also be angry and we can be sad. And we may be going through all those stages multiple times a day. In the morning, we may be having a great day, and then all of a sudden another policy change happens, and we are back again on the disbelief, on the anger, and we rotate throughout. And that's not a failure to be going back and forth through the stages. That is normal for us to be able to map where our pain is and be able to understand and use different strategies at times. And then the last framework that I kind of want to introduce, which is the least known also too, is the concept of, it's called moral injury. In moral injury, it's a concept that came out actually way back in the war, World War II, when military were forced to do things that they did not really wanted to do, that went against their ethical beliefs, which created this misalignment on what my ethics are and what my behavior is having to be, which creates this anxiety, stressful situation, and can really lead to feeling really angry, losing trust in systems, losing trust in self, in people. And then that concept kind of just stayed there for many decades, and then got researched during the COVID pandemic to use it for healthcare workers that were having to do really hard decisions in between who gets care and who doesn't get care due to the resources and how many people were sick, right? That also left a lot of the healthcare population, healthcare workers really feeling very stressed out, very sad, with a lot of emotions. And I definitely think that for us right now in the human rights field, to be able to understand that it's not just burnout. Burnout is when systems are not built for us. They're not giving us the support that we need. We're overloaded, we're overworked. It is not an individual thing. But often it gets made out like, well, you didn't do self-care. You didn't put boundaries. Yeah, there's also systems that are happening. But moral injury really comes in right now as, hey, I signed up to be a human rights defender. I signed up to, be an immigration lawyer. And now you're asking me to close programs and leave children without representation and accompany minors. Or it looks like I am a therapist that focused my entire career in serving survivors of torture, and now I have to close down my practice, and I cannot see these clients that I know for a fact ethically need these resources right now. So see how it kind of just does not compute, does not align, and that creates that. So being able to have that framework that is not you, that there is a problem, that there's other outside issues that are happening, helps us a lot. And then, so that's kind of like the framework. But then for tools, I think it also really helpful to be able to acknowledge that we cannot do these alone. And sometimes you can say things like, I cannot carry these alone. Let's share the load. Understanding moral boundaries, understanding moral witnessing, which is acknowledging that there's an injustice without taking full responsibility for it. Also, forgiveness practices, release self-blame for circumstances that are beyond your control. which is easier said than done. I know that. But especially when we have family members, loved ones that may be in our home countries that are experiencing very difficult things, and you're the one that was able to get away or get into safety. But utilizing some of those resources is really helpful. And being able to kind of think of a window of tolerance identifying what are your stress responses, and when you're starting seeing those, use whatever has worked for you in the past to help you get back to a moderate. So if you're thinking from a 0 to 10 scale, 10 being the worst that you could ever feel, you no longer want to be here, you want to flee, flight, or fawn, to 1, I'm feeling fantastic. So you want to be around a 7 max. When you're at a 7, start using your tools, and that may be thinking of a place that you can remove yourself for a second. It may be mentally, physically. It may be using your senses. Your senses are fantastic. Nothing gets to our brain unless it goes through our senses. So using smell, if you have a particular smell that helps you feel calm, utilizing that. A particular sound, maybe it's music. It's just essentially using what has worked for you in the past.
Diana, I'm wondering if you could explain a little bit more what that forgiveness practice looks like. I think just hearing you, I know that's something within myself that I need to get better at, just taking responsibility for the things that are in my control and the ones that aren't, and accepting that, we can't change everything. But like you said, it is easier said than done, and I'm sure that other people listening are probably in that boat.
Yeah, and I think there's a couple ways to go about it. One of them is doing some every day, almost like a count, and it could just be in your head of something that you have accomplished and that you have put towards whatever your fight is, and then that helps us see. I did a little bit today that actually helped. And with that, I kind of want to share these because for me, I'm a very visual person, but there's this really cute story in Ecuadorian folklore that there's this tiny hummingbird in the forest and there's a giant fire. And I think we can all agree that we are in a big fire right now. But this little hummingbird kept going back and forth from the river to the fire, bringing just this tiny little bit of a drop of water. And all the animals were laughing at it. They were like, "Hey, what are you doing? Like, you're not making any difference, you tiny little bird." And he turns around and says, "I'm doing what I can." And we're all doing what we can in a place that is not right now the best. Is a giant fire, but making a count, even one little thing, even if that's like, I showed up to my office today. I made that call that I have been dragging to do for a week. I held the space for my coworkers. So make an account of what you have done. It helps us know that we are not just not doing anything. So that helps us release some of that blame. Also visualizing, if you are a journal person, journal what you have done. Actually put in writing, I'm releasing these blame of whatever it is that you're carrying with you. Or you can even think of, if you're at an office, you can make a visual of a box. I used to keep this box in my office when I used to do therapy in person, in which at the end of the day, I put in there all the worries that I have for my clients, for my patients. When I did psych evals, I pictured putting them there and closing them before I left my office. And then knowing that I could always go back and open it next morning to continue working on those, either in a report or in notes. But being able to leave that behind and having some visuals, it really helps out also to releasing some of that heaviness and being able to know that in order for you to be there for everybody else, you also have to have some breaks in between. Does that help?
Yeah, that was really helpful. And I know some people are saying that they really appreciate the hummingbird story and the doing what I can moments. And someone also shared in the chat that some asylum seekers have needed to go into ER because they don't understand panic, they don't understand anxiety attacks.
Yeah, and that happens so often because what it feels a panic attack feels like you're dying. It feels like you're having a full blown heart attack, a stroke, whatever that is. So being able to help them, if you are a practitioner, to kind of just put a visual, and I can send Isabel to a couple visual tools that you can use, especially the window of tolerance that I was working with, that kind of just helps you see where you are. And it takes practice. It's not going to be right away, but to be able to know what feels at what level, and sometimes it's not the anxiety attack. Sometimes it's hypo, right? Sometimes it may be just completely disconnected, no facial eye contact, face just feels numb. That's also another response. So just knowing exactly what that looks like, and also having language. So for a lot of us in our cultures, we don't even have the language for some mental health symptoms. So it may look like, oh, my back hurts, my body hurts, but why does it hurt, right? Does it hurt because you were up all night and you haven't slept for weeks, more than an hour or two? Does it hurt because it's so tense that your body's starting to just really have a hard time? So having the language to speak about it, it's amazing. Words do a lot to be able to actually express what our body's feeling and it's holding in.
So, what can people do if they are allies or advocates, or if they are working directly with immigrants and refugees? Given that we're all going through the moment together, but some communities are most impacted than others. So, what is a good way for allies and other advocates to show their support beyond just awareness, and also without falling into a cycle of outrage and feeling like we can't do enough? You're on mute, Diana.
Sorry about that. Yeah, I really like that you mentioned that the experiences are different, because it's true. We're sharing an experience, but we're not experiencing the same way because of our own personal, unique modifiers of what our history is, what our trauma is, what our coping skills are, in what position we are in life right now. So definitely, I've been thinking a lot about these, and I've been working lately with different organizations doing some workshops on what can they do. So I've been able to see several different strategies that I really like. I think one of the ones more at a systems level and an admin level or ally funders level, I have seen organizations that have extended, they have done contracts with their employment programs, employment assistance programs, EAP. So usually those are things that you have available through your job that usually give you maybe 4 or 5 sessions of therapy. If you need them, if you're stressed at work and whatnot. So I have seen one agency that I really like, that they worked with their provider to extend that to make about 12 sessions for individuals, which are sessions that are free for them. They don't have to use their insurance. It's fantastic. So that is something that is really helpful. I have seen other agencies also provide legal counsel, like not just full-blown legal counsel, but just like a a screen, and to be able to kind of support them. And also HR departments working with their staff that have different types of visas, and kind of providing know your rights presentations for them on what is happening and what can be some of the possibilities for them. So those are some tangible tools. And of course, if there's any funders here, please consider funding those who are in community organizing. They are the ones that are closer to the communities and know what's happening. So those are some ways at a more macro level, more individual level. If you are just there, checking in on your co-workers when you can. And I put that with caveat, because first, if you want to share something, I always say, please ask them if they're in a position or in a space in which they can hear you. And then also asking them, what are some top, when you're not in full-blown emergency, ask your coworkers, what are some top 2 things that help you stay calm? Or what is something that you absolutely love food wise? I had a coworker one day, was having a really awful time, and she had asked me these, I don't know, a year ago. And all of a sudden, I got to my office. I had been off for a whole week, and there was a little cupcake with a note, and it was my favorite cupcake flavor. And I just knew, she didn't have to say anything. I just knew that she had my back, that she has heard me, that she cared about me, and that communal spaces is just so important right now for us.
I love that story of your coworker that did that. I hope all of us can have very kind coworkers and friends like that. And this is the end of our conversation today with Diana. But I sincerely hope that for all of you listening right now, or if you listen to the episode at a later time, the conversation around mental health and healing will continue in your places of work, in your families, among your friend groups, and even with yourself, implementing some of the strategies that Diana suggested. Lots of writing, lots of journaling to get things out and put it into words. We'll stay here for a couple of minutes if folks have any questions that they want to ask Diana while she's still here.
Yes, and I have also put in the chat, I don't know if it's public or private, but I have put in our toolkit. If you're interested in seeing more strategies that you can just sit with it and kind of take them in, go to our website. We have some resources there. That's one of them. But we also have additional resources too for organizations during these times. And thank you so much, Isabel, Refugee Matters podcast. Thank you, everybody that joined us today as well. I'm so happy that you're here. And I am holding you all in thoughts in my heart and sending the best energy so that you can continue the work. And thank you for all that you do.
Thank you, Diana. There's a comment in the chat that I think it is important to acknowledge from Nu, saying that it's important to recognize that these techniques may not be effective in all situations, and seeking professional help is sometimes necessary, and it should be normalized.
Absolutely. Thank you for bringing that out. I forgot to mention. And yeah, those are kind of like immediate self-soothing, but therapy, everybody should go to therapy. It's just amazing the things that you can learn, that you can discover about yourself. I do recommend shop around your therapist. And as a therapist, I'm telling you, shop around, because it is, you have to be the right fit for that clinician, and for that clinician for you as well. So a lot of us have 15-minute consultations that are free. Don't feel bad. You're not wasting our time. It's actually the best thing that you can do is to make sure that you go in and see that person, ask that person, do it virtual, see if it feels like the right vibe, do your research. There's a lot more clinicians these days that are doing also holistic, more traditional practices, indigenous practices as well. Search for them. There's a couple resources that I will also send of directories of BIPOC therapists in case that you're interested in. And also, if actually you sign up with a therapist and 2-3 sessions in, it doesn't feel the right fit, don't feel the pressure to stay there. Try a different place, but don't give up on therapy just because it was one therapist that it did not fit right. In particularly for us that are in this type of work, it is very, very important that you get the right fit, because not everybody has had the experience or understanding of the intensity of the things that we have seen, that we have lived, and in the field that we're in. So thank you for bringing that up in the chat. But yes, do your research and make sure that you get the right fit.
Do you want to share some places where people can find more about your work and your toolkits, Diana, and how to work with you?
Yes, sure. So we have, you can go to our website. It's just corazon-norte.com. And if you go to the resource page, we have our self-preservation toolkit that it was really great. It was done with one of my really dear coworkers, Elizabeth Camarena, who's an immigration attorney. So it kind of has both perspectives of the legal and the mental health field together. We're very proud of that toolkit, and I'm sure you have seen maybe some people around, but if you haven't, check it out. It's great. We also have some other resources on Know Your Rights, but trauma informed. So how you can do Know Your Rights presentations within your organizations, but also making sure that we're taking care of the heart of the people attending those, and also resources on family preparedness. We do lots of workshops with organizations as well on self-preservation, trauma-informed approaches. And also, we have a really cute boutique. Check it out. We have merch related to mental health, belonging, and immigration. And also, you can always reach me at info@corazonnorte.com. Or through the website if you are interested. We also do check-ins, like not full-blown therapy, but like maybe 4 or 5 sessions for those in activism that may be interested in checking in with somebody, but they may not be full ready for therapy, or they may just be wanting to touch base about what's happening within their work site.
Thank you so much, Diana, and thank you for everyone for joining us for this live recording of Refugee Matters. To stay updated about when we will be having a next episode, please subscribe to our newsletter. Visit us at weareallus.org and subscribe to our newsletter, and follow us across different social media channels at We Are All America. Thank you so much for joining us, and I wish you all a great rest of your day.